Medical care can seem a little like alphabet soup these days. You might see an MD or a DO, a PA, or maybe an NP. Consumer Reports examined each designation down to the letter and determined that what it spells out is better care for patients.
Need to see a doctor? Take a seat. It could be a while. 29 days on average for a new patient to see a family medicine physician, compared with 19 and a half days in 2014. Part of the problem is a shortage of primary care physicians in the United States compared to other developed nations, and patients are feeling the crunch.
Both in terms of the wait time to get in to see a doctor, the wait time in the waiting room, and then sometimes feeling like the doctor is distracted or overworked in the office.
To help fill the bench, many practices are now taking a team approach to healthcare.
MDs, we have DOs, osteopathic doctors, RNs, nurse practitioners, PAs, and we all work together as teams.
Healthcare professionals say the end result is greater access to care. Primary care doctors are swamped, especially during a busy flu season. But if a patient is willing to see a PA, that's a physician assistant, or an NP, nurse practitioner,
they could often see that person within hours and get the care that they need.
Even though they don't have as much training, Consumer Reports says in many cases it's fine to see a nurse practitioner or physician assistant for routine matters. However, there are circumstances when you might want to ask to see a physician.
Complex problems where you're not seeing a resolution, where treatment isn't working, where the diagnosis is very difficult and mysterious.
On the whole, the team-based approach is growing. More than 60% of physicians now work alongside advanced practice providers, and Dr. Meixler fully expects the trend to continue.
I think it's good, and I think it's healthy, and I think it's going to help patients overall.
Medical, and if you're considering a practice that uses an array of healthcare providers, make sure you can check with your insurance company to make sure that all of the professionals in that practice are actually in network and their services are all covered.